Author of Galcania and Maidin, everybody's very welcome here this morning. We're delighted to continue our seminar series here in the Social Sciences Institute in Maynooth University, organised jointly by myself, Seán, Foghlú, my colleague Professor Mark Boyle, and our colleague Dr John O'Connor. We have a really interesting, let's call it chat ahead today, and we're really looking forward to this. We're joined by a colleague from the School of Business here in Maynooth, Dr. Nicola Mountford. We're joined also by Dr. Anne Cody in the HRB, and you're very welcome, Anna, and also Dr. Avril Kennan, who's the CEO of Health Research Charities Ireland. And they're going to reflect on their work together on the New Foundations project. I'm not going to say anything more about it because I know they're going to talk about it. And we're going to follow our regular format of listening to them for a while, then just having a bit of chat about it, and we'll hopefully be able to involve the people online in terms of making comments that we can then bring to the panelists. So over to the three of you for a big line of.
Thanks very much, Seán. Thanks for the invitation. It's really nice to be here and lovely to be here with such great colleagues and collaborators. I was just thinking as we were being introduced there, 3 doctors, and if we were on a plane, none of us would be any use if anything actually went wrong. But yeah, so we'll try and be less doctory today, I think, and talk a bit more about collaboration and how this works. So I am going to just give you literally 3 slides on the project and what it was, just so you have context. But our brief was to talk more about the process of collaborating and the impact that that had on all of us and our organisations. So we'll try and get through the kind of housekeeping bit as quickly as possible, and then we propose to just have a fairly informal chat between us to sort of reprise some of the discussions we had as we went through the project. So hopefully that's on brief. So just to introduce you, I suppose, to the joint funding scheme. So this was a project funded by Research Ireland. It was then the Irish Research Council under their New Foundations funding scheme. And the New Foundations funding scheme funds researchers and universities to work with organisations outside of the university environment, and usually non-profits and community-based organisations. So we worked with HRCI, and then we brought in the HRB as a partner. And the brief was to look at this joint funding scheme that these 2 organisations run collaboratively. So the joint funding scheme is, as it says here, it's a kind of a co-funding scheme between the charities that are the member organisations of Health Research Charities Ireland and the HRB. So the charities work with researchers, they come up with projects, they put them through to the HRB, and the HRB then convenes a panel to review those and to decide which ones to co-fund. So the charities are putting some of their own money in, and then the HRB put in money as well. And as far as we know, there's no real equivalent to this internationally. And what was really interesting for me, and what HRCI in the first instance were very interested in investigating, was the voice of public and patient participants on the panel when it got to the HRB decision-making process. So it's a substantial scheme. You know, there's been over 28 million invested in the research from this scheme since it started, and they're currently right in the middle of the next funding cycle. So Anna and I will be able to talk to you a bit more about that as well. So just to give you a sense of how the scheme works, so it opens up, I have just switched the whole thing off. I was looking for my laser pointer, being the lecturer that I am. Yeah. So the scheme opens up and people, the HRB and HRCI generally, the thing that has really struck me about both of these organisations is, I mean, they really are the definition of learning organisations. So everything they do, they evaluate and reflect on, and then incorporate that learning into their next cycle of action. And so when I started looking at this, the first thing we were told was, well, when this opens, the first thing that happens is we review what happened last time. and we decide what to do next, which is really reassuring if you're going in to do some research on this, because you have some certainty that it will be looked at and the results will be considered in the next round. So what happens is the HRB and HRCI come together, they look at what happened last time, the evaluations, and then they redesign or tweak or open the scheme as it should be. So the charities then open their call, and people like me and Olga and Mark, we all researchers based on universities, we respond to the calls that the charities have put out, and we develop proposals. The charities then review and select their own proposals, and they put those through then to the HRB process. And the HRB convenes, after various checks and balances, convenes a joint selection panel, and on that panel you have scientific representatives and you have public and patient involvement representatives, and they have different roles in that scheme, and their voice has different weights at different points in the process. But then the panel recommends which proposals they think should be funded, and that goes to the HRB board then for approval. So what we did was we reviewed a lot of documentation around the scheme. You would think there might only be 1 or 2 documents, but no, there were 29. So we created a database, looked at all of those, and then we went out and interviewed 27 people. And that would have included people who were involved in organising the scheme from the different agencies. It would have included scientific members who sat on the panel. It would have included scientific panel members, and it also included PIs and principal investigators, so the researchers from the universities involved. And that is really probably as much as I'm going to say. So we produced some documentation as a result of that. We had some findings around what good inclusive decision making looks like in a funding scheme, and so things like, you know, how you get the balance right between expertise, for example, and accessibility, you know, how you balance the amount of documentation and the detail and the rigor of that with it being feasible for people to get involved, how you balance the representativeness of a public and patient involvement member with the idea that you can't have 20 of them on a panel, you know, so are they representing a specific group of patients, or are they just representing the public, and dealing with questions like that and where the voice comes in. So we published a summary report which is available on the HRCI website. Behind that sits a much more detailed document, which is about 80 pages long, I think, is it? And that has been digested at length by both organisations. And then we just produced a nice little infographic, which is a lot easier to digest. So I think that sort of takes us up. Did I miss anything?
No.
No.
I think.
Okay. So that's that bit. I might just say, just in case I forget to do it later, that there was an excellent research assistant working on this, Emily Merrick, and she did all the interviews and a lot of the analysis, and was absolutely super. And that we did have Dr. Sarah Delaney and Dr. Aoife Cahill also on our advisory board, and they were super. And Sarah in particular, I hope you don't mind me singling out Sarah in particular, and it really was the genesis of the whole project. And that might be an interesting place to start, maybe, Avril. So I got an email from Noreen in our RDO, and in it said HRCI are interested in working with a researcher on, I think there were 4 or 5 different things, networks and something else. And I guess Sarah called and said, what is it you're interested in?
Yeah, so the story behind that really is that we were aware that this new foundation scheme was coming up, and we always encourage our member charities to be proactive about that. So it is researchers who apply for that, but they need a charity partner. And so we do encourage them to be proactive and to reach out. And we were sitting around at a team meeting and thought, well, what would we want to do if we were the charity partner? And obviously the joint funding scheme is such an initiative. It's one of our major initiatives, and it's very, very central to everything that we do. And we thought, well, we're constantly looking at the, you know, to keep on brief with today, the policies around that and how we shape it with the HRB. but wouldn't it be lovely to have an external perspective and to have somebody take a deep dive into it that wasn't us, and particularly with the researcher lens. And so that's where that came from. And we actually went out to all the universities, and the research offices kindly shared that with the research communities, and it came to you. And we had met you before at that point, and then as you said, you got in touch with Sarah. And I suppose the only other thing to say at that point is that we were very open. I guess we, again, being very, as a charity, being very involved in the research space, we were very aware that we didn't want to be too leading, that we're going to really value the independence of it. And so we had kept it quite open, if you remember.
Yeah.
It was sort of just like, we'd like some research done into this. And then you took it up and talked to us, and we shaped it together.
Yeah, that's right. And then so Sarah and I then had a couple of chats, and then
Yes.
and then once we sort of realized, so it wasn't that I won the lottery or anything, I was just the only person who replied. Is that that's the but that has been and that has been a sort of a learning for me, though, was that and because that's happened again to me quite recently with a new foundation scheme, where I have replied sort of saying, geez, you know, if you're really stuck, I could maybe help to realize that I was the only person who had replied. And so, you know, I think that's really interesting for us as researchers. I think we kind of have a sense that, you know, when people are posing big, important questions, that there's all these people competing to answer them, when actually there just might not be. You know, you might just be the only available option. So so that was interesting. So then the research had to switch to suit what I was able to do then.
Yes.
Yes.
Which we were very happy with. And we did, you know, shape it a little bit together, but we were, at that point, we were really happy to let you lead and for it to fit with your particular interests. And, you know, I think it's fascinating that you do research around decision making and decision points. And that lens actually turned out to be really, really interesting for the joint funding scheme.
Yeah. And then you said to me, we need to get the HRB involved. And I have to say, I kind of thought, oh gosh, I hope this is going to be okay. Because first of all, I thought, I hope this is going to be okay when Research Ireland are funding the research, and the HRB are going to be doing. But also, I kind of thought, oh, now does this put more pressure on me to find a good result? You know, like I was a little nervous, I have to say, because it wasn't like, you know, I might never be applying to the HRB for funding myself again. You know, I was kind of thinking, I have to emerge intact from this, but I also have to, you know, be ethically sound in my research. So this could be tricky. But every interaction I had, I have to say, with Anna and Aoife was so reassuring, like that you were genuinely saying, if there's anything we need to fix, you just tell us about it. So what was it like from your perspective?
Well,
then Anna,
just for the record, we don't have a blacklist.
Yeah.
The wrong result. But no, I mean, Avril, you contacted me first, and I mean, we have a long-standing relationship. Like, that scheme has been going for best part of 20 years now, and I think there's just a huge level of trust and collaboration between us. And I know if I ever need a steer, I can come to you, and hopefully the other way around. So, you know, that I had a very positive starting point. And if you're saying you can work with Nicola, then I'm sure I can work with Nicola. So it's and we do have that ethos in the HRB of saying, you know, every time you look at what went well and what didn't go well, there is no scheme. I think I can say that fairly confidently. I don't think there's ever been any scheme I've been involved in, and I've been in the HRB for 20 years, that ran again a second time and was exactly the same as the first time. There's always a change. The scale of change differs, but we always learn. And we had done a scheme evaluation of that scheme maybe 10, 12 years earlier that had a different focus. That was looking at outputs and outcomes, and it was also to some degree looking at formats. You know, there were all sorts of ideas flying around at the time, what it might be other than projects. And there had been quite a lot of engagement with the charities around that, and there were some very strong opinions about how things should be done. But that's been a while. And it's also, you know, a lot of the people have changed and the environment has changed. So it was a really good opportunity actually to look at that fresh and from that particular decision-making angle. And you know, it's been, again, from our perspective, it's been really, really positive all the way through. And we are delighted if somebody can say, okay, we're doing a piece of research here. You have a particular role in it, but we'll get you all that pertinent information that you can then use. Okay, that's great. That's on a silver platter. Thank you.
Yeah. So yeah,
And just say, I mean, that's the first time that I've heard that you had a bit of nervousness around that. And of course I should have realised that.
very cool. It's not. Of course, that's no problem.
Of course you would have. And I mean, I had the advantage that I worked with Anna for years. I know how open she is. And also I know that she's a leader in an international initiative around ensuring value in research. And there's a lot of talk at that level, which always makes me laugh a little bit, research on research. So I had that advantage, but it is interesting that it should have occurred to me to express that to you at the time.
Well, I mean, I could have expressed my own, but yeah, no, I thought I'd just go along for the ride and see what happens. Here we are, thankfully. But you were just saying about the roles, like you know, your role in it, and then, you know, at the end there being a silver platter. So maybe what we did was we formed an advisory board, and we didn't meet terribly often. Like, it was a short enough project. So I think we were about 9 months maybe in the project phase. So we met about 3 or 4 times. So maybe you could talk a bit about what that was like, being on the advisory board, whether you had enough say in what was happening, whether it was, you know, too much time being spent, you know, how did that feel?
It felt very comfortable.
Okay.
It was, I think it struck the balance between, and you kept on saying you don't want to draw too much on our time, which I do appreciate, but at the same time to allow input where needed and where, you know, where we genuinely might give a steer one way or the other. And no, I thought it was a really, really good balance and very open. You know, when we met you, it was very clear that there'd be that integrity and outside perspective that Avril had mentioned, which, you know, we value as well. You know, we are a research funder, and so we are very much aware of the value of research. Yeah. And of that independent perspective. And I certainly felt that you'd be in a position to extract some information that we wouldn't be in conversation with the charities, for example, that, you know, we wouldn't be the right people to ask. Yeah. So that steering group worked very well from my perspective.
Yeah, also, it was all very easy and it went very well. I do think there's something interesting there around when let's use the term charity, but any civil society organization is the one who comes up with the research idea. And that happens actually, I think, more than people realize. And that absolutely can be challenging. We were fortunate in this case that we were able to be quite open about what that looked like. We didn't desperately need something in particular. We wanted 2 things. We wanted that outside independent perspective, and we also were hoping for something that would allow us to tell the impact story a little bit in a different way to other things we're doing. We were very confident as well that people really like this scheme. We know the challenges, we know there are hard parts for everybody who's involved, but basically, you know, through these conversations over years with our member organizations in particular, but others as well, we know that they view it positively. So we were quite comfortable with that. And I think you don't always have that luxury you know, I've worked in organizations in the past where you have a really specific research idea and this is the thing you need done. And I've also experienced that going completely off track and losing control of that, because ultimately the money is not coming to the charity. Say it's a new foundations award, but many of the schemes, the money isn't coming to you. So you do lose that control. And that was not the case this time at all, because we were able to be open and because of you and how you approached it.
Okay. And so I'm conscious of time. I'm not sure how we're doing time-wise.
Keep going.
Keep going. But I was going to say maybe we should get to what you did as a result of it, just in case we missed that bit. So I don't know. Do you want to talk about that? What?
Yeah.
So you got your report, you got your results.
And that detailed report was really what mattered to us. There were so many, so there two layers of things in there. Sort of one was kind of where there is a general sense of most of the comments pointing in one direction. And then there's sometimes the good idea that maybe only one person said, but it's still a really good idea. And having that detail allowed us to kind of sift through and go through what is a good idea, but then what's also implementable.
Yeah.
And, you know, we needed to look through that lens of what's practical and what's doable without adding a huge amount of work onto either of our organizations, but would add value. And I suppose the biggest change that came out of this was that it had been a process that was based on kind of emails and kind of offline things in a way. Every other scheme we do goes through an online platform and grant management system. And there were various reasons why that wasn't, because the charities do the first step of inviting the application, of doing the peer review, of then selecting which ones they want to send on to us. And the commentary was really pointing in the direction that, you know, if we could find a way of keeping that level of ownership for the charity,
because it's their money, right?
Well, it's half their money, half our money. You know, this is a joint endeavor. Whilst at the same time addressing the research needs of the charity. So they have a bigger stake from that perspective, but we're the experts in terms of managing that process. This is what we do. So how do you marry all these different things? And we did manage to find a way of getting the whole scheme from the beginning, from application stage, into our GEMS grant management system, and to give the charities control over various steps within that. And well, you know, we're in the middle of doing it right now. We will have again an evaluation once we have completed this cycle. So far, so good.
Yeah.
And that's a massive change. Can I just say that? It might sound trivial to you. This is massive.
Yeah. I think there's an interesting element to that as well, in that, yes, so the charities find that peer review process so hard. These are very under-resourced organizations, and they're often, not always, some of them are very familiar, but often they're really stepping outside their comfort zone to manage international peer review, and it takes huge time. And so the research was really pointing to that being a challenge, and we knew that, and it was, you know, with some hard evidence of that then. But in the context of today, that was the engaged research bit, and then we had the evidence. And then, of course, we needed to bring to use that evidence to influence policy. And I think the fact that we were involved at that stage as well, not just the engaged research stage, I think that was a really interesting thing to take away, because we could possibly have gone the route of the HRB. I don't know if you would have been willing to do this, but the HRB take over the peer review. And I would have thought that that's what the charities would jump at. But we did do a consultation with them. We did an honest, very open, very discussion-based consultation with them, and we really got into what exactly do you want around this? And I guess because we built up years of trust and they know they can speak openly, and it was interesting to me that they said, yeah, we do want some help, but we also want the control. And so that then we landed on that kind of in between place where, yeah, this is going to be easier for them, but they also still have that element of control about who those international peer reviewers are, for example.
So when I hand over the report, there's then a piece of work that you have to do to sort of sanity check it and translate it and bring people on board in order to make this actual change happen. Yeah,
exactly.
And that's a substantial piece of work afterwards.
Yes.
And I think that's probably true for most projects that you want to really impact on policy, because it's never just now we have the solution, off we go. It's really, you need that feasibility check on your own end, and then just the implementation is significant as well.
Yeah.
And so I haven't been involved in that bit at all, right?
Yeah.
So so is that deliberate? Like, is it easier to be able to sort of separate out then the researcher from the implementation? Do you know what I'm saying?
I think it's very context dependent. I mean, I think you had given us a really clear steer, and at that point we just needed to say, okay, but how exactly would the charities like to work that to work, and what is possible for the HRB? So I think in that case, I think in a lot of evidence for policy processes, the researcher would still be very much involved in those discussions. And then what can get left out sometimes is the societal partner or the charity, whoever it is, getting left out at that point. And I think that's an important thing for people to remember, because there's so many perspectives and there's complications at that stage.
Like, your members had to be happy with this for it to work.
Yes.
Yeah, I think that's really interesting. And I think when we were chatting about this, I was saying that my perspective had changed slightly. So, when we were starting this project, I would have been saying, I'll be handing over the report, and then it's up to you what you do with it, and I'll know, and I should say all the good ideas were not mine or Emily's. They were ideas that came from the interviewees, right? So all the ideas came from the interviewees. We came no credit for those at all. But I think I was saying I think my view has changed slightly, in that I think I feel a greater responsibility now. I think, like, it's great to see this happen, and now I'd be thinking, oh, if I was doing something like this again, I'd really want to see it have an impact, whereas before I was just sort of more interested in the question. I think this has sort of activated something in me that is more impact focused, which I find kind of concerning.
More work.
I think it's that step from just presenting the evidence to then making recommendations.
Yes.
What does that evidence mean?
Yeah, like, we didn't really make recommendations though, did we? Or did you feel like we did? Because I felt like we didn't, but if you felt like we did, that's really interesting.
Well, I think there were very clear findings and very clear crunch points where we now had a steer what charities wanted, and yes, it needed to be explored in a little bit more detail. But that had actually changed from the mood music from the previous evaluation, where there was very much a question of ownership, and charities would have been extremely nervous to hand over any of this to the HRB because they felt they would lose control.
Yeah.
And that had changed, and I'm not sure why it has changed, if that's just, there's now a very long period of that scheme and there's a level of trust developed, or if it's a change in the people, or if it's I don't know, there could have been lots of explanations for that. But just, that mood music was really quite different, and we would never have wanted to do something that alienates the charity partners in
Yeah.
that, you know, what's the point in that? And you know, it's certain things that we need to do from a governance perspective, and where we feel we're dispersing public funding, we have a responsibility to make sure that we can stand over our processes, and they're red lines. And that's, you know, there are red lines. Not that the charities want to push them, but there would be. But beyond that, we're very, very open to do whatever it takes for the charity partners, and that's where we need to be.
And that's why the mood music has changed, because we've both worked very hard over many years now to build that trust. And that is through listening and engaging and responding, and not always being able to offer solutions to things, but by listening, and then you stepping into that space. I think it's been really, really helpful as well, because you've allowed another avenue for people to express what they like and what they don't like, and to feel heard, and then to see that being responded to. So I think that's been great as well.
Yeah.
Okay, yeah. I might be out of a job.
Sorry.
That's really interesting, and a great way to have the dialogue between you to draw it out. I'm actually going to try and split you down to join you back together, just one by one, if that's all right. I might start with Nicola, just with a few, just to understand. You've set out here, let's say a change or a shift in your personal thinking, and maybe even your personal philosophy. So as a result of this involvement and probably maybe other parallel things, to now not seeing your job or your role as being to undertake research and complete it, but actually to move on the research impact-wise, policy or wherever the impact is. Do you want to just talk a little bit more about that?
Yeah, I mean, I think like anyone who's involved in research or academia will know, you know, there's a growing list of things that we are now responsible for as researchers. And Olga's got a brilliant LinkedIn post on this just very recently as well. But you know, can we do everything? I don't know. Can we publish and teach excellently and publish in top tier journals and win lots of funding and, you know, grow fantastic PhD students and have a real impact on the world around us, and still have our families at home and our own lives, and, you know, play a bit of sport or whatever it is? I don't know whether we can do all of that or not. And so I think in a sort of spirit of self-preservation, I had quite a blinkered perspective, which was I will teach as well as I can, I will publish as well as I can, and I will try and grow a team of really good researchers. And I didn't really, I kind of blanked off the impact conversion bit, because I just wasn't sure how I could achieve that all. And then I started working with you guys, and then through you, I have been working with other people who are just so fantastic, like 22Q Ireland and Children's Hospital Ireland and the PPI Ignite network, and all these other things that I've now become involved in, which have just made my research life so much more meaningful and so much more interesting. And that sort of makes up for the extra work, I find. And that's the difference. The difference is I just enjoy it all so much more that I'm willing to do more of it. And it just makes everything a bit better. You know, everything becomes more interesting, more exciting. Teaching becomes better. The PhD students that are here today are, you know, we have more fun. I think we have more fun. We have interesting questions to answer. Funding, it seems to be a little easier to get. So, you know, yeah, it's almost more, it was almost more just the brain, the ability of my brain to handle it all was daunting. But actually feel like the energy and the meaning involved in it expands your brain to allow it to do all of that. Yeah, I don't know if that makes sense or not.
And slightly different question, but I just where you started this story, I think it's just important just to go back to that, because in Maynooth, in the research office, Noreen Lacey has been leading an engagement kind of with health charities and the HRB, and it's kind of she's kind of operating as an in-between person.
Yes.
You hadn't been in that group of engagements too much, but she was seeking to broaden it out, and you just saw something that sort of piqued a little bit of interest.
Exactly.
But having Noreen in the middle, she's not here today, her colleague Deirdre Clayton is here today. Having somebody in the middle between enabled you to connect. So there was something about the system, and Maynooth has a strong enough, I suppose, culture of engaging with these sorts of with the Health Research Charities. We'll come to that in a second. There's something culturally within Maynooth that is open to this.
I totally agree with that. Yeah, I mean, like I have worked in other universities, and it's, you know, it isn't the same, I would say. The focus and sort of interest in engaging, particularly I would say with the non-profit sector, is much higher here in Maynooth. And actually we were just chatting before over coffee. I was saying to Anna, you know, like, we're not a typical business school, you know, we're not all about you know, capitalism and making money for the man. And you know, we do, like, not just me, like all of my colleagues, we do really important, interesting work. You know, we look at the ethics of business. You know, we look at how AI is transforming the world. I don't, but my colleagues, you know, we look at how education can be designed better. So, like, business is about organizing things and organizations, and I would say that there's a big difference in the way Maynooth approaches that. And then the supporting infrastructure in people like Noreen and Deirdre and the RDO. I mean, this is a tiny grant we did this on. Like, it's €12,000. You know, in a larger university, nobody would pay any attention to that money. You know, you'd be irrelevant. But here in Maynooth, it's not that the money, it's still only €12,000, but it's the partnership approach that underpins that new foundations funding in particular, that makes that very important in Maynooth. Maynooth values that. And for me as a researcher in the university, that's really important, that I know that if I put all of the work into doing this, that my university will value that work, because otherwise it becomes very difficult. You're kind of swimming against the tide. Yeah.
I'm going to turn to you, Avril. You're a fairly unique organisation too. I know there's lots of charities out there, but there aren't many organisations that pull the charities together collectively and are able to lead strategically. And there's also a certain cultural dimension to how you want to work together and how you want to influence. So do you want to talk to us a bit about how that has developed and your thinking behind that?
Yeah, that's a big one. But I guess, I suppose at the heart, it's about service. I grew up in the service industry, and I think that plays into it. And when you're running an umbrella organization, your job is service. It's to make their jobs easier and better and help them. Ultimately, all our member organizations are about improving lives one way or another. So, and they come to us for the bit that they do around research, using research to do that. And so our job really is to support them in all of that. And we've really over the years grown a very, very strong community where we're supporting them, we're learning from them, and they're supporting each other. So that's the support bit. And there's all sorts of things we do through that, including, of course, the joint funding scheme. And then the other bit is to represent them at a national level, and to try and pull together what their concerns are around research, and then bring that to a higher level to try and implement change. And I suppose that's how we have been thinking about it over the years. Those two elements. Does that get to what you're talking about? Yeah.
And I mean, there's kind of advocacy and there's research, and they go separately and they go hand in hand.
Yes. Yes.
So do you find that sometimes it works well, the research and advocacy together to impact on change, such as with the HRB, and do you find that sometimes it doesn't? And can you talk a little bit around the behaviours that enable it to be effective, and sometimes that's not necessarily yours, behaviours of the organisations you're engaging with? You don't need to name them, but
so certainly, we advocate very strongly for using for the charities themselves to use an evidence base in what they do, but also in what they're trying to influence that advocacy piece. So we would talk a lot about evidence-based advocacy. And we actually have a guide on that very topic to support the charities in getting into what is evidence, and actually that's when you really start to break that down, that's really challenging. So what is evidence, and how might you find some to support what you're trying to do? And how, if you can't find it, how might you generate some? So we talk a lot about that stuff. Does it work well? I think we've seen lots of good examples of charities who are really drawing on that now to improve their advocacy. Also, with an understanding that policymakers are expecting it more. So you can't go into the Department of Health and say, we need this, this, and this, without saying why and what is the evidence underpinning that. So I think that, yes, that is working really well. I still think we're a long way off doing that more effectively. So when you ask, are there times that it doesn't work well? I can't think off the top of my head of times that it doesn't work well, where it backfires, or where, again, we're always mindful to talk to them about the fact that they need to be open. If they fund or initiate in some way a project to generate some evidence for their advocacy, they have to be really open as to what comes out of that, and not to cherry pick as well. So I guess those are the dangers there. But I can't think of any examples where it hasn't worked well as such. More that we just need to get better at it and do more of it, and really bring our sector into that space as well.
And what about advocating with research for PPI? Sorry, for this particular research enabled more engagement. Are you winning that? Are you winning people over on this concept more broadly as a result of research?
And in terms of more PPI happening and more engaged research happening, yes.
And the views of patients and so on feeding into policy.
So I'm kind of at the moment, and this is maybe not ideal, I'm kind of seeing that in two stages, where it's the research piece. We are definitely improving things on the research side, no question. And we have real leadership in Ireland on that. And Mark is here from PPI Ignite here in Maynooth, and you've been involved in the PPI Ignite network for years, and the research office have been so strong involved. So absolutely, we are mid-culture change with that, and very well along in culture change. The second part of that is the PPI, let's call it, or engagement in the policy making. And I think we're much earlier in that conversation. And I kind of understand that in many ways. I think that is an early conversation as a whole in Ireland. So you and others are really leading on making that happen. It hasn't been happening in the past. And so understandably, perhaps the focus is on that researcher policymaker connection. I would advocate that we need to also be thinking about the people the policy is going to affect, and thinking about that now rather than slotting that in later.
Can I maybe comment on that? I think you're absolutely right. However, there's also been, policy comes at different levels, and for those big national policies like a cancer policy or the mental health policy, or those big strategic documents, the Department of Health has a long history now of involving affected people in the phrasing, the framing and development of policies. Rare diseases one was a really important one, and heavily influenced by patients or parents of patients. Even the first one. And I think Department of Health is the one that is clearly miles ahead of any other government department in terms of both using evidence to underpin their policy, but also of involving people that are affected by the topic of the research. And the HSE is beginning to put more structures in place to support the voice of service users in their development of structures, in their development of services. And you know, it's not perfect by a long shot, but there is an underlying understanding that there's value in that, I think. And yeah, as you say, we're on a journey, but it does have high level buy-in, which is really important. It's not just a grassroots revolution, but there is actually a top-down understanding that there's value.
I'm going to come to you, Anna, but I was just going to say, I see a lot of parallels in the concept here with student involvement in, say, education. And we had a seminar, actually a precursor to this series, where we looked at the work of the National Council for Curriculum and Assessment and Research Undertaking. I chaired that body, so just a bit of a conflict of interest on how toddlers and babies were consulted on the Astor early years framework, as an example. So there are other very innovative areas where it's trying to get into exactly what you're talking about. But I want to come to you because the HRB and your culture and your openness not just your culture, but the culture you're seeking to support and develop. You've had a focus on evidence for policy for a long time. You know, we've actually put up, Mark put it up there, that the conference you've got in a couple of weeks, that's the information's coming up if anybody can attend. I know it's nearly sold out, but maybe not quite yet. So and your openness to look at keeping review. You said earlier on, no funding call stays the same. Your openness to keep on reviewing your funding calls and the way in which there's something culturally going on. Do you want to just talk a little bit about that?
Yeah, I think it's fundamental. I mean, if we're not learning, how can we expect others to learn and take evidence on board? You know, it's totally baked in.
And how does it manifest itself then?
There are they're just process points where you look, where you know that you have to go back and look. And this is how we when we have new staff joining us, you know, this is a perspective that we want, but actually we particularly value the fresh eyes, because sometimes you get caught up in just doing things because you've been doing them that way before, and to be able to say, okay, just why? And we don't always have enough time to reflect on that. But at the same time, you need to take those opportunities. And maybe one opportunity that's coming up for us is we are in the process of procuring a new grant management system. And that means that everything we do on a process level is up for grabs. You know, it's we can look at everything and see if there's a better way, a simpler way, something that makes it easier for HRB staff or for external users, be they applicants, be they host institutions, panel members, reviewers. And you need to grab those opportunities. You need to build in the time.
Do you work with other research funders then? And how, I mean, I know you can't speak for other research funders, but how to impact on them culturally for the same sort of the outcome that you're describing? Can you say anything about that?
We are part of quite a few groups of funders, or sometimes it's funders only, and sometimes it's funders and research performing institutions. In various different contexts, they all of them have a reason, all of them have a particular remit. So Avril mentioned the Ensuring Value in Research Funders Forum, which is something that I found really useful over the years, where it's just research funders. So everybody has the same level of understanding, and everybody wants to influence, not just do their own processes and actions best, but also leverage the influence we can have over the system. So when we see that there's something like PPI that we think will make a real difference to the value and the impact of the research we fund, we can actively support that. How do we do that best? You know, it's not just put it out there and a researcher can make a choice, but how do you drive behavior without just saying, okay, here's a requirement and here's a hoop to jump through, whether you like it or not, you just have to do it. But how can you make it easy? How can you make it?
But you also have something culturally about working with the charity sector, don't you?
Oh yeah. And again, we couldn't do this scheme without HRCI. We could not provide that coordination between charities, and we really couldn't manage lots and lots of different schemes with individual funders, and that just the workload would explode.
So it's the brokerage of Avril that then is, so it's a brokerage service that she's offering.
Yeah, we could absolutely not do that without HRCI. And it's actually one of the schemes that, if you just look from an outputs level, performs really well, and has performed really well over many years.
Okay. Mark, you want to?
Yeah, just a couple of questions come in, but this panel's so good. People have asked questions and then they've said, oh, ignore that because the panel's already just answered the question that I've got. But one of the areas that Bridget McManus and Jennifer has mentioned is the funding, and you mentioned there, Anne, about the leverage, how to use the money, and that's one of the great things about collaborating is you're unlocking much more bang for the buck than you would otherwise get just funding yourself. Now this funding, the central role of funders in the research for policy space is going to, I think, become a bigger issue with Research Ireland, new strategic plan and so on. So I suppose the question is there any more general takeaways from your experience about the best way to use a finite pot of public research money to unlock more impact from research for policy across different departments beyond health? Is there any wider lessons and takeaways for using judiciously the funds you've got to extract much more value?
Well, my experience relates to Department of Health type funding or health related funding, but I think there are a couple of ground rules that apply across the board, and I think, Nicola, you kind of made those work really neatly in our specific context, and that is about the need to really collaborate, to really listen to each other, and if you want your research to make a difference, then the person that you expect to act on it needs to want that research, and needs to be it needs to be in a format and in a way that they can use it, and having that ongoing conversation, each respecting each other's limitations, and also respecting each other's expertise. So you are the research expert, but maybe, you know, somebody else knows about how a service is delivered and what's possible and what other factors come in about the workforce, or about, you know, what other interactions there might be. I think that is an absolutely crucial one. We need to arrive jointly at questions that are of relevance and that take both sides, the researcher side, but also the what we call knowledge user side into account.
I think, you know, thinking about, there's a lot of thoughts on abundance and asset-led research for policy work, and I think that's what you're doing. You're recognising that actually there's an already existing infrastructure of talent, expertise, interest, networks and so on. And the starting point then is how can we leverage and sweat the assets we've already got to maximise the outcome. So that, looking upon the research for policy landscape, not through the lens of scarcity. We've not got enough of things, but through the lens of abundance. We've got an abundance of things. The key question is how to unlock the abundance. Nicola, for yourself, for your point of view, given you researched this, the study of the importance of research funding and the methods of research funding and the methods of review, the methods for evaluating funding, is, in our view, beginning to become pivotal to whether or not Ireland will move towards a more research-based public policy system. And the Research Ireland is going to be pivotal on this. From your study of this particular process, did you see any generic takeaways about, if Research Ireland was to ask you from this experience, could you tell us, you know, what seems to help in the study of the funding of research in helping these projects?
This isn't directly answering your question, but I think the thing that struck me immediately, like the minute we started doing this research, and you know, Emily was coming back to me and telling me what she'd heard, and was that I've never, I mean, I apply for funding all the time. We all do here in the university. And if you ask anybody about funding processes and research funding processes, they will tell you all the things that are wrong with the way all the organizations make their decisions, because they didn't get the last grant, or they didn't get their feedback on time, and they didn't get, so nobody's ever happy, you know, unless they win the money. And what struck me immediately about this was the charities who hadn't gotten funded, who were telling us what an amazing scheme this was, and how robust the process was, and how happy they were for the people who did get the funding. I mean, that I'd never heard a response like that to research funding from people who hadn't gotten funded. And so that immediately intrigued me, and that is why I was so I suppose activated to find out what is it about the way this scheme is making decisions that means that the people who don't get funded are advocates of the process. And what it came down to, I think, was the organization of it, and how smooth that is, and how involved everybody feels from the beginning in it, but also the way that the stakeholder voice is incorporated, and the fact that that voice becomes stronger as the process goes on, and they're really making the decision. It's the PPI contributors who ultimately decide what gets funded. So even though their weighting is lower in the process, and the initial decisions, you know, you've got 100 proposals, and you know, you get rid of the first 50, let's say, because they're just not scientifically sound, you know, or whatever. And as you get down to the last 10, 15, the scientists around the table are kind of saying, these are all much of a muchness at this point, really. And there's sort of a bit of a kind of, you know, satisficing kind of thing. I've sort of done my job now. I'm here for 2 days. I'm pretty wrecked. I'm happy they're all, you know, they're all scientifically sound. But the PPI participants don't sit back at that point. They're like, no, that one is better, and this is why it's better, and this is why you should fund that one. And so they get to push it over the edge at the end, which is really important. And what I've never heard of before, and that seems to have tremendous impact, is that a lot of this deliberation is open to all of the charities. So they're sitting like if we were having this discussion, they're sitting in the room or online in COVID times, and listening to us. They can't input, but they're listening to us having this conversation where I'm saying, no, you must fund this one, and you're saying it's not scientifically sound, and so that transparency of process. So it's the involvement, the transparency, the ownership, and those things make the decision hold, even for people who don't get funded. And if we could bring that into all areas of public funding, research or otherwise, wouldn't we have decisions that would stand up in the court of public opinion, you know?
Brings in to your broader research area.
Yes.
Do you want to say something like that?
Yeah, without turning people off the topic. So yeah, so I suppose this is about research funding, and that is very much the focus here. And that is fascinating. But I suppose my interest as my research team is on a slightly broader scale about how we make decisions around public funding and public services. And so, how do we make decisions that won't get overturned in the court of public opinion? And myself, one of my colleagues, Dr. Gillian Moore, have been doing quite a bit of work around drug reimbursement decisions, for example, and how those get overturned, how that process maybe doesn't allow in some of these good things that you guys have in your process, that people don't feel ownership in it. It perhaps does lack transparency. And so, we've kind of developed this concept of sort of hot and cold forums for making these decisions. And what you're doing, I think, is taking what would traditionally be very cold type of decision-making forum, would be closed off, there'd be scientists making the decisions, everybody, would be outside the door, and then they'd be given the result at the end, and you're kind of warming it up a bit, like you're bringing in stakeholders, you're opening the doors, and to my mind, that creates a stronger result, and that result stands then. Whereas, when we have sort of colder decision-making forums that don't bring stakeholders in, that shut the doors, and that privilege scientific expertise over lived experience. I'm not saying I think there's a strong role for scientific expertise. I hope to be one of those, when I grow up. But like we have to make room for other types of expertise, and in doing so, I actually think we strengthen the output.
So it's the
and
landability,
legitimize that.
the landability and the societal favouring of implementation is gone.
Exactly, because we have all these decisions that could be the right decision, who knows, they go out into the world as policy, and then they get unpicked by the media, by the public opinion, and then we have politicians who are on the back foot, they're trying to unpick something, hard decisions particularly get unpicked, and maybe those are the ones we actually need to stand up and hold. And then people start to shy away from making hard decisions because their experience of making hard decisions is that it gets unpicked and there's a political cost to it. Whereas maybe if we made them differently, not even saying the decision is different at the outset, but if we made them differently and we took some of the things that you are doing in your processes, and we built them into other funding decisions, maybe we could make stronger decisions that hold up.
That's fascinating. Yeah, again, your external perspective on it. I might just add that it is also really hard. So when you spoke to people, that was months after decisions were made, but actually on the day in the room when they don't get funded, that is really hard because they're funders, but they're very emotionally invested funders, and they have put huge work into it, and then they have to sit at the back of the room and not say a word as these very difficult decisions are made, and there can be frustrations and upset even. And then the other side of that is that the successful ones don't want to celebrate. So much so that we actually started a celebration event some months after the decisions, so that we let it lie for a little while, and then but people should have the opportunity to celebrate these wonderful projects, and so we still do it, and that's the important bit. We still do it, but it isn't always easy.
So
Yeah.
there's a time there that sort of allows people to process.
Yeah,
Yeah, that's
yeah, because it
interesting.
is really
Yeah.
hard. Yeah,
And it is important that in the room, the charities are observers.
yeah,
You know, they can't chip in and say, but this is really important.
Mm.
They're not there as advocates in this, at that point. But maybe to come to that kind of transparency side as well, whilst this is a scheme that has a very particular format and which we, I think all parties in that value that. We have also observers from research offices from across our host institutions in all or many of our other panels. We used to have Irish panel members years and years ago, and then we phased them out because, quite frankly, Ireland is too small and people are conflicted. And we had a steady stream of people going in and out of the door because they were conflicted. And that was fine, and that's good from a governance perspective. However, at that time, Irish researchers had a really strong insight, as a community, had a really strong insight in how the HRB works and how decisions are made. And they were very confident in that. And over the next 10, 15 years, that kind of washed out of the system a bit. And I started hearing these mutterings of
I probably muttered about your process.
yeah. And you go like, you know what? You can understand why. So we set up this observer initiative. We did think about if we should allow individual researchers. Quite frankly, there's too many researchers, nowhere near enough opportunities to observe, and we didn't want to potentially give an advantage or seem to be giving an advantage to this and this individual and not others. But the research offices are kind of that conduit, and it's something that I think, and I mean, maybe you can speak to that from your experience of it.
Just for this is for the online, so we're bringing in Deirdre Clinton.
I was actually just going to comment on it at the end there when you were talking about the transparency of the process and you know, the kind of patient voice as well. I was actually just going to comment and the research office voice because and I stand to be corrected, I think you're probably the only national funder that does that. And you know, my colleague Noreen is more familiar with it than I. She has sat in on one or two of those observation panels, but it's a fantastic initiative. And again, I think it would take some of that if other funders were to do this, and I have raised it with other funders as an example. I think it would be a fantastic wealth of knowledge, firstly, for kind of research officers to take back to the community, but also would give that, as you said, the kind of the muttering that I didn't get funded and they're sure, look, that's a waste of time. You know, I'll never apply to that again. That scheme's a waste of time or whatever. It would take that level of frustration and muttering and kind of undertones away, that if we were able to go out and go, well, look, we observed, this is what happened. It is all very robust and we've learned a great deal. And sure, look, reapply next year because now I've sat in on that process and I can bring that intelligence back to the wider community. It's a fantastic initiative, and I really would hope that other national funders would follow that example.
There, any comments or questions from the room?
Hi, I'm Mark Robinson. I really enjoyed the discussion that you've had, and there's one aspect that kind of intrigued me a little bit, and I think it comes back to the HRB as an organisation. It was very good to obviously the partnership between all of you developed that policy, but the HRB was ready as an organisation to then implement that policy. And I wonder if there's maybe something that needs to be done around the willingness of the organisations to actually implement change in response to policy and research, and whether we are able to measure the impact in the implementation phase. And I guess also relating to that is, are we good at bringing in stakeholders at that implementation part? Because that's also, you can see it with the charities actually coming on board and a really good interaction in the implementation, but is that one of the issues as well, that maybe we're good at involving stakeholders in policy and producing the policy documents, but then we're not so good at involving them in the actual implementation of those policies? Whether that's
as well.
Hi, thanks very much. I'm Fergal Lynch, formerly at the University of Galway, and further back in my career I was in the Department of Health. So thank you. I hugely enjoyed your discussion there. What struck me about all of this is the real involvement of patient voice and how you actually successfully do it. It must be one of the most intractable things. And certainly when I was involved in that area, genuinely involving patients and service users in the process. Is there any way you could maybe even give us a short set of do's and don'ts or key learnings from your attempts, and obviously very successful processes in involving patients and service users? Because as I say, it's one that seems intractable in so many areas. And you've commented, or Seán mentioned, involvement of service users in other areas, including education. It's happened in children, where I used to work as well in the Department of Children. But it must be one of the most difficult research elements of anything that you're doing. Thanks.
Okay. Thanks.
When I pick up on the first one, or the last one first, yeah, I mean, it is challenging. There's no question. And I think if you were to cut it down into a few things that make a difference, it's all about, as everything in life, it's all about relationships, right? And the more time you have to build a relationship, the better. And to really think about it like that, and think about, well, how do we build relationships, and how do we make people feel comfortable? And you don't always have a lot of time, but when you do, that is really, really helpful. And I think for researchers, and speaking as a past researcher myself, and for policymakers, there has to be a willingness to let go a little bit of being the expert. So very much bringing your own expertise, and you should be respected in that, but also be open to other types of expertise and respecting that as well. We could probably talk about it all day, but I think those are two of the really important bits.
And to get over your fear. I think there are a lot of people who are very reluctant to be shown up, or to not be the expert, or to sit there and say, I don't know this. Tell me, please. It's a vulnerability. And
that's really hard, because you are expected to be an expert.
Yes.
And expected to demonstrate that you're an expert. So that's really hard to let go of. Yeah.
Any further reflections, Nicola?
No, I think these, you guys are the experts at it. Just as a researcher, I would say, there is a fear. There's a fear. It's not so much a fear of not being seen as the expert, but it's a fear that you genuinely just don't know what you're doing, and so that can be off-putting. If you're going in to deal with what can often be vulnerable in an ethical sense, populations, and you're not sure how to deal with that, I think that can be a very scary place for a researcher to be. So I'm currently planning a project in navigating ethics around, children with disabilities, and I'm frankly terrified, and I have really good collaborators who are going to help me, but that's a scary place for a researcher to be. And I was at a table recently at Noreen's Better Together research event with two charities that looked at suicide and mental health, and they were saying how difficult it is to get researchers to work with them on anything because they're scared, So I think sometimes it might be seen as a fear of not being the expert, but sometimes it's just a genuine concern that you might get things wrong and people might get hurt as a result. So that's overcoming that is tricky, and it's about the right collaborators, I think, who you trust to guide you.
And knowing you're not alone in that as well. That it's a really common experience.
Yeah. And putting it on the table at the beginning and saying, I might do something wrong here. Please pull me up.
Exactly.
Okay.
And maybe to get back to Mark's question
yes,
about
Mark.
implementation, yeah, you're probably, yes, I'd say you're right in terms of we're better at involving people affected by a policy in the policy making, and maybe not so good in the implementation. It requires so many different actors, and implementation is a very broad concept, I suppose. I can see the HSE making some moves towards that, but it's a long way from being perfect.
Okay. That was really, really, really interesting. And the collective and individual reflections, the project itself, but the collective and individual reflections and the impact of that on how we all do our business, I think is really, really interesting. Mark, do you have any comments before we
Seán. So thank you very much. It was brilliant. I really enjoyed that. We've had lots of the seminars on researching problems around formulating policy, implementing policy, and then we've asking, does that research help the policy improve or not? But what we've had today is something different again, and that is research on research for the effectiveness of policy. And it's a very important point, I think, because if we're not researching policy in a way which actually is able to be then communicated to policymakers to improve policy, it's our research practices that are the problem, not the policy capacity to listen to those. So I think as we look at Research Ireland's new strategy, as we begin to think about research funders has been a critical catalyst to the building of an ecosystem in the country. This question you've been asking about research for research on policy and the efficacy and probity of those kind of research methods and strategies, and you have presided over, is really, really important. So I think we captured some of the takeaways for that. First of all, I think we do need to have some repository for the wisdom that has been collected here. I know Nicola's report then is part of that, but there's a reflexive intelligence that we may lose if we don't try to look at this research on research for policy and have some kind of way of capturing and sharing that. I think Research Ireland, for example, would benefit hugely from actually getting a group of people yourselves in the room and just picking the brains about, okay, well, we want to fund research which is going to be speaking to public policy issues in a way that's meaningful and effective. How do you do that? How do we commission research that achieves that goal? And if they're beginning from scratch, they're missing out on a repository of wisdom. I think one of the things that's come across is the process is key in doing that. It seems to me the whole process from start to finish is designed with that mission in mind. So the call, the nature of it, the division of labour in the call, and so on. I think that lesson is that it's not that Research Ireland, for example, can tag on, or any funder can tag on policy as another bit of an application, but the actual fundamental design of the commissioning of the research needs to be different. And Nicola's introduced hot and cold cultures. I love that idea. And I'm wondering if it could be hot at some stages in the process of commissioning research, colder at other stages, a bit like my shower in the morning. It's got a life of its own. But also sanity checks, I think you mentioned, which I thought was really good. And leveraging important, the abundance question. It's clear to see that HRB, one of the great strengths that you've done is you've recognised that there's already existing expertise that you could partner with to get far more value for money. So I think as we think about funding research that's going to maximise policy, it's mandating that they extract every last value cent out of it by partnering to the most opportune level, most effective level, to make sure every euro goes as far as it can go. Locus of control you mentioned, which I thought was interesting, and I think that is an interesting question, that the charities want to retain control, and indicated the importance of that. Nicola's indicated the importance of that, and also talked about red lines, which I thought was interesting. And it does, get me wonder, where is the locus of control best lodged when you're commissioning research for policy? Because there's questions of democracy, of research prioritization, of maintaining scientific integrity and so on, of advocacy versus science. But nonetheless, that autonomy for charities is pivotal, because if it's not there, it drains the motivation of co-producing. So thinking about the distribution of the locus of control throughout the process, that maximizes outcomes and maximizes all the democratic and scientific criteria, as well as your health research criteria, I think is an important lesson to learn. And the final point I wanted to make, and it relates to Nicola's observation, Avril maybe thought was a more retrospective observation, and that was the joy of celebrating success amongst those who failed. Now that's astonishing, fantastic, and astonishing. And I think I'll be curious as to know the genesis of that, because if that is a real, if that really is a kind of significant outcome of your process, then there's definitely something to learn around that. My view, I think, about the difficulties of maintaining harmony in funding calls where there's so much rejection rates is the question of rejection rates. Some calls have 5% success or 10%, most maybe 20%. So by definition, 4 out of 5 applicants are investing huge amounts of time into the application and not. So I think that some of the resentment comes from the scale of investment required to put an application in. So is there any way of managing the attrition of those projects by saying, well, you didn't get this award, but we encourage you to develop in this way, or get peer feedback that allows to resubmit, or to develop a paper and write a book up, or so managing the unsuccessful candidates, I think, is key. Minimizing the administration burdens of initial screening, I think, can help improve people's kind of happiness with the process. And I just remember I was working with a private sector company once, and I was talking about collaborating, and we were talking about them, and we got very far into the process, and the guy goes, it was Jaguar Land Rover. Don't ask me why I was partnering with Jaguar Land Rover, but in Liverpool, and they said, so what's the success rate here? I said, oh, maybe 5 to 7%. And he's looking at me as if to say, what? That might be tolerable in your line, but there's no way I can justify putting resources into a 5% success rate. And he was really disillusioned with the, very upset at me for wasting his time, actually. So I think that multi-stakeholder partnership, the complexity of it, and so on and so forth, that the success rates are a major thing for keeping people on board, keep people happy, managing disappointments, and so on. But thank you very much.
Thanks, Mark. So we have a happy Mark, actually, because he's no longer having to celebrate defeat after Tuesday night and the great Scotland victory. So for a change.
Oh no, that's the whole team. We're 1984, if I remember right.
Anyway, look, that was really good. Thank you very, very much. Mark has kind of summarised many of the insights, so I won't go back into it. But I think we've lots of positive feedback online as well, and we've had 25 people online, and a lot of people watch back afterwards as well. This isn't actually finished now, because it becomes a live thing online. So we really do appreciate your inputs. So could we have a big hand for our 3 participants? Could I also I want to thank Orla Dunn and Anne Hamilton Black in the Social Sciences Institute who make this all happen. And if it wasn't for the online aspect and the hybrid aspect, this would be a very different series. And it would actually be it's the combination that you need to be in person to make it effective, but you need to have a hybrid to make people be able to link in now and afterwards. And it's really, really good. So particular thanks to them. They were really part of the conference that we organised last week as well, jointly with the Department of Further and Higher Education and with UCD. And for those who weren't there, it's a very hard job getting it up online. We'll have it up online in a couple of weeks, so people can look at aspects of that if they're interested. We're keeping going with the seminar series. We're announcing the next round very, very soon, and we'll be going. We've one on the 21st of January about local government. We've Aoife McGly's coming in as the Chief Science Advisor on the 18th of February. On the 26th of March, on the day when Ireland will be in the playoffs, but not Scotland, and the draw hadn't happened as of 5 minutes ago. We've a political one, which is looking at how research policy can link into the political system. We former Minister Dennis Naughton and Claire Hickey from the Houses of the Oireachtas. And then we're back to health again on the 14th of May when we Barbara Whelan in Galway, John O'Neill in the Department of Health, and Teresa McGuire from the HRB, looking at evidence synthesis and so on. So we've a very interesting series coming up. So thanks to everybody for engaging, and thanks to those online who stuck with it until the end. So good to meet you,